Hi, this is Dr. Fruth, family physician, and this is today's consultation. Today I'd like to talk about the male wellness visit. Here's something I've always wondered about. Why is it that women tend to come in for an annual health check and men don't? Well, healthcare systems have traditionally reached out to women because it's believed that women tend to be the gateways to the family's healthcare, and that women tend to make the important decisions about healthcare for the family and for their children. And there also seems to be this macho attitude with men that because they don't have a vagina, cervix, and a uterus, that they really don't need to come in for healthcare. But I'd like to provide evidence to the contrary. According to our national healthcare statistics, women still have 5 years more of lifespan than men have. And men tend to die at higher rates for 4 major causes of death that do have some preventable component. That's heart disease, cancer, infectious disease of the lower respiratory tract, and unintentional injury. So call it what you want. The annual health checkup, the annual physical exam, the annual wellness visit, the health maintenance exam, whatever we call it, go get it. Here's what should be done. You want to be sure that you have your blood pressure checked on a regular basis. Blood pressure over 130/80 is pre-hypertension. And blood pressure over 140/90, that's hypertension. It is important to have that system run under a low pressure. Think of your body like a machine. The delicate elastic tubes in your body are your blood vessels, and they tend to wear out sooner if they run under high pressure. And the pump, that being the heart, tends to wear out earlier or sooner if it runs under high pressure. So you want to be sure that you keep your blood pressure low so you don't pop a tube or blow a gasket. Keeping that pressure low helps the filter, which is your kidneys, the pump, your heart, and the CPU, your brain. And here's something interesting. The most delicate bed of blood vessels in your body are the ones that go to your penis. Well, now that I've got your attention, high blood pressure over time tends to cause wear and tear on those delicate blood vessels that go to the penis and are a contributor to erectile dysfunction. Also, on a routine basis, you want to have your cholesterol checked. Cholesterol is that fatty substance that tends to clog the arteries that go to your brain, your heart, your blood vessels, your eyes, your boy parts. And you also want to be screened for diabetes. Elevated blood sugar tends to damage the delicate lining of those blood vessels that go to your brain, your eyes, your heart, your boy parts. Also, you want to be sure that you have your immunizations up to date. The flu shot is a very important annual immunization. When it turns out that 20 to 40,000 people die every year of influenza and nobody dies of a flu shot, get your annual flu shot. Another immunization that's important is the Tdap. Tetanus, diphtheria, and pertussis or whooping cough. You want to be sure that that's updated on a regular basis. Another vaccine that's appropriate for men up to age 21 is the HPV vaccination, and up to age 26 for some men. Another thing to be considering is that the health of your teeth is also important to the health of your heart. So be sure that you're getting annual checkups for your dental care. Let's also talk a second about STD testing. It's pretty common for people to have more than one sex partner during their lives. And it's important to do the right thing, and that's to be sure that you're not passing on an STD to a sexual partner. So be sure that you're tested on a regular basis if you do have more than one sex partner for chlamydia, gonorrhea, HIV, syphilis, and don't forget hepatitis C and hepatitis B. There's a couple other things that I like to talk to my patients about. Considering that in 2015, 35,000 people died of opioid overdose, and that addiction touches 1 in 7 people in the United States. I want my patients to be aware of Narcan, which is used to reverse an opioid overdose, and it's available without a prescription in most states. I also like to talk about HIV prevention, and that's with medications called PEP and PrEP. So if patients have high risk for contracting HIV, they need to know about those drug regimens. Well, employers and insurance companies want their employees and subscribers to get annual health care visits because it saves them money. A no copay visit is common for most healthcare plans. So while you take your car in to get an annual checkup, take in the most complex machine that you own, you and your body. This is Dr. Fruth, family physician, and this is today's consultation. This video is meant for educational purposes, so please consult your healthcare professional for specific questions about your healthcare needs.